Hi, I'm Dr. David Greene, CEO of the Nevada Pain Network, where we connect those in pain with the best pain management doctors throughout the greater Las Vegas and Henderson areas. Today the topic is, what are the best treatments for sacroiliac joint pain? Well, first of all, let me just define what that is, okay? You have your lumbar spine coming down here, and then your sacrum, which is the bottommost part of your spine. The sacrum connects on both sides with an area called the ilium, which is basically the pelvis, okay? Now, these joints, the sacroiliac joint, contain cartilage just like your hip, your knee, and other joints in your body. And they are prone to arthritis just like any joint as we age. And it may be from post-traumatic after a car accident, or it could be just, the beauty of aging. Great, right? Okay, so as you can see, this joint is a little bit jagged, very long, okay? So it has a little bit of movement associated with it. It's not a ball and socket joint like your hip. Your hip has a ton of range of motion, okay? But it does have enough movement to where it can cause a lot of pain if there's arthritis. And it can wax and wane just like any arthritis in any joint. All right, so what are the best treatments for it? Well, first and foremost, over-the-counter medications like Tylenol and anti-inflammatories such as Motrin or naproxen can be very helpful. Just take them according to the manufacturer's recommended dosing, and it may be all that you need for, mild to moderate pain, okay? Now, if that's not quite enough and you're having a short-term acute exacerbation, a pain doctor may prescribe something stronger, all right? And that may be a narcotic or something of that nature. And that's best for short-term. Prescribing narcotics long-term for an arthritic situation is not usually a good idea. Now, chiropractic treatments can be very helpful for sacroiliac joint pain, okay? As I mentioned, there is some micromotion in these joints, so a chiropractor can help do manipulations and other types of things, like prescribe a TENS unit maybe, that can give a lot of pain relief, that doesn't involve anything invasive, okay? Physical therapy can be very, very helpful, maybe some ultrasound, some electrical stimulation, some range of motion to help provide some pain relief as well. Now, when you get into the interventional pain management realm, that's when you can get some real good pain relief. And one of those is a simple steroid injection. Now, the best pain management doctors, such as the ones that we work with at Innovative Pain Care, perform injections under fluoroscopy, which is a real-time form of X-ray, or ultrasound works well too. Now, as you can see, it can be a little bit difficult to get into this joint. There's an overhang of the ilium, so it can be a wicked angle to get in. But once you do, you can get some nice steroid medication in there and give some nice pain relief for months at a time, okay? If that wears off, those can be repeated, or the newest, most modern treatment for SI joint pain is called a radiofrequency ablation. And that's where a pain management doctor will apply thermal energy to the area around the joint to deaden those little nerve endings that are causing pain to be felt in the joint. And that can give pain relief for over 6 months at a time. It can be very effective. It can decrease the amount of medications you need. It can increase your ability to do recreational activities, play with your kids or grandkids. So it can be very helpful. So SI joint pain is known to cause up to 25% of low back pain. So don't underestimate the potential of what these two joints can do in a bad way to you. So visit our website today at painmanagementlasvegas.com. You'll see information about the best pain clinics in the Las Vegas and Henderson area that we work with, Innovative Pain Care. The pain doctors are award-winning, double board certified, fellowship trained. They take most major medical insurances. You can see that on the website. There's a lot of educational information there as well. I'm Dr. David Greene, CEO of the Nevada Pain Network. Your pain stops here.